In the United States, there are still 28 million people having a hard time accessing their basic healthcare needs. Among the most impacted are the immigrants who are constantly living in fear. For example, meet Maria. Maria works at a nearby field here in Hillsboro, Oregon. Maria is a very hard worker, but has a hard time getting by due to the cultural differences. Due to this, navigating our healthcare system is nearly impossible for her. She is also one of 11 million undocumented immigrants in this country, so she rarely seeks health-related services due to the fear of deportation. Maria doesn't know it yet, but given her family history, she's at risk of diabetes and isn't expected to live past the age of 55. To help manage her condition, Maria is recommended to see a health provider on a regular basis, but this is nearly impossible since she never gets a day off. And the rare occasion she does go, she takes her oldest son for a translation. I still remember going to the clinic with my mom, Maria, and having a hard time translating since I wasn't familiarized with the medical terms Dr. Gary was using. After 11 minutes of trying to translate, Dr. Gary recommends that my mom eat whole grains, whole foods, potatoes, and tofu. Due to the cultural differences, Dr. Gary failed to recognize that our food pantry was filled with arroz, frijoles, and tortillas. Hello, my name is Hiro Miguel, and we started Kamino Care to help Maria, who is my mom. In the process, I found there were other people who struggled with this experience as well. Why? Because our current healthcare system was not built for us. Take for example my friend Fatima, who is in the middle. She is Muslim and was given nutrition advice during Ramadan by a health provider who didn't fully understand the scope of fasting or her tradition. Or Mr. Truong, a Southeast Asian patient that believed the doctor's office was angry because of the atmosphere of brisk efficiency rather than welcoming politeness. Or my LGBTQ friend, Sarah, who is often refused health and wellness services due to her sexual orientation. There is currently no system in place that will make it easier for us. We must design a better one. In today's world, if you're looking to get from point A to point B, you can do so by hopping on an Uber. If you're traveling and need a place to stay, you can get an Airbnb. Even Netflix knows what shows and movies to recommend you. So we took the best of these experiences and created a new one. A new health experience that's inclusive of everyone. Introducing Kamino, which is Spanish for path. At Kamino Care, we're creating a new path to preventative health and wellness. Here's how it works. First, Maria logs into the Kamino Care app. On the home screen, she can see the list of her upcoming appointments. Today, she's looking for a nutritionist to better manage her diabetes. After clicking the Find a Provider button, she can select from other services like alternative health, dental health, physical health, well-being, or mental health. On this occasion, she chooses to work with Jessica Garcia, a nutritionist she's worked with in the past. Next, for this visit, she selects the visit to be an in-person visit instead of a virtual one. And finally, she chooses a date and time that works best for her. Friday, March 20th, at 6 p.m. after work seems convenient. After clicking the Request Appointment button, she has finished her request. What does this mean for Maria? Maria is now connected with a health provider that understands her. The provider comes to Maria's home. By coming to Maria's home, the provider has a better understanding of the neighborhood Maria lives in, the grocery stores around, her food pantry, and the internal family dynamics. During this visit, we were there. She was taught how to cook with the preferred ingredients to better manage her condition. With the current widespread of COVID-19, also known as coronavirus, if Maria is concerned, she can use our chat/video function to interact with a provider of her choosing without leaving her home. On this occasion, Maria chooses to work with Julia Garza, a family nurse practitioner she's worked with in the past. Since it's a chat meeting, she clicks on the chat button next to Julia's profile to start the conversation. Here Maria speaks with a provider in her native language, Spanish. For those that know Spanish, can understand this particular dialogue between Maria and her provider. This experience doesn't only resonate with our user, but also our providers. We're now in the process of onboarding 500 health providers to our platform from all over the United States and even Spanish-speaking countries like Mexico and Spain. Here's why. Many of them growing up envision themselves taking care of people, not rushing them in and out of appointments. They enjoy the flexibility we offer, as well as the additional income so they can do the things they love, like travel the world. But above all, they are tied to our mission of pushing the healthcare world from diagnostic care towards preventative care. In my mom's case, the ideal situation wouldn't be managing her condition. It would be to prevent it in the first place. And that's what we're doing at Kamino. We've assembled a kick-ass team to help push this mission. I, Heber Miguel, am the CEO and co-founder and run the business side of Kamino. Nick Morgan, our other co-founder, has over 20 years UX experience and has previously worked with the top tech companies of the world such as H5, Salesforce, and PayPal. He is also our chief architect of our tech and leads our development team. And lastly, Marian Handler. She's advising us in business-to-business employer benefit packages and plans. Combined, our team has over 50 years experience in tech and have already implemented platforms like Kamino at Qualcomm and Nike. We invite you to be part of this new health experience. We're currently in a private pilot, but will open to the public on April 8th, 2020. Let me repeat that again. We'll be launching to the public on April 8th, 2020 at OHSU Healthcare Demo Day. You can sign up to be the first ones to know when we've publicly launched at CaminoCare.com. And to finish, let us get the message out there and let us build a really, really cool healthcare future that's inclusive of everyone. Thank you very much.